even people with insurance who live in Colorado should care about healthcare reform because we all pay a price for those who are uninsured. It gets passed on to those who do have insurance, and the employers pay more and the consumers pay more. So we've all got a stake in this fight. The values that I think are most important as we look at Colorado healthcare reform, including finding affordable, accessible healthcare. It also needs to be high quality. We don't want any compromise in the quality of care, but we have to find a way to bring down the costs and get more people insured. We face a lot of challenges in terms of healthcare reform in Colorado, but one of the biggest ones is we need to get on the same page. We need to determine what are our common values, and then we need to deal with the challenges that we face in a system that currently isn't working. The information we have is that Coloradans are very concerned about the high cost of healthcare, and that's very appropriate. That is something that's a barrier to many of us. I think what we do to address that is we have to look at different ways of providing healthcare. One of those ways might be using nurse practitioners more. Another is to have a stronger emphasis on wellness and prevention programs. There are many good ideas out there. It's just time that we put them into place. Through the 208 Commission, there's been conversation about whether Colorado should adopt a plan that has an employer mandate, possibly individual mandate, and of course there's always the current situation where there is no mandate. I think we need to talk about all these options. We have to consider what the costs are, what we might do to improve healthcare based on which plan we adopt. But all ideas should be out on the table. I think we have an obligation to discuss those ideas, debate them. We may not all agree, but at the end of the day, we need a new approach to healthcare in Colorado. Reforming Colorado's healthcare is going to be a long-term project. There's no way we can do this overnight, and it's going to take a lot of thought. I think where we start, again, is on prevention and wellness. There are things we can do that can be considered low-hanging fruit. We need to ease the administrative burden. We need to look at the costs that aren't providing any value in healthcare, and we need to start with those and address those, and then work our way through the list. One of the questions I'm sure people are concerned about is whether we can come up with a bipartisan solution to healthcare reform in Colorado. And I don't think it's really an issue that we can't find common ground on. We won't agree on all the details. I think the people of Colorado ultimately will indicate with their vote how they feel about it, but it's such an important issue. I think it's an issue that citizens have said this is near their top of the list or at the top of the list. And I think the policymakers, the lawmakers recognize that piece. So it's been a little while in the coming, but I think all of the lawmakers recognize it's time for reform, and I think it has to be bipartisan. So we're all going to have to give a little to get to a common solution, but I think we can do it. One of the questions people might ask themselves, well, I'm somebody with a normal life. I don't live at the Capitol. I don't spend every waking day trying to come up with healthcare policy solutions. I just know that it needs to be done. But one of the priorities that I think everybody should have is to get educated on the issues. We have had the 208 Commission that's worked very hard for the past year. They have 5 proposals with a website that lists those out. Even if you don't use the internet or you don't really want to get into that kind of detail, certainly the newspapers and media are covering this, and so are your lawmakers. So you should get engaged in the conversation. You need to know what we're considering, because without your input, we can't get to the best solution. So I hope everyone will get involved. The Partnership for a Healthy Colorado is a nice coalition, and by nice what I mean is people who normally wouldn't be at the same table have come together to try and find that common solution I was talking about. And that I think sets a good role model for the rest of the state. Again, we won't all agree on all the details, but we have a lot of work to do, and we're not going to do it in isolation from each other. So I think the partnership is, I appreciate it existing, and I hope they and everybody out there in the state of Colorado will urge their lawmakers to do the same. to come together at the same table and come up with some solutions that move us forward.